Hello, my name is Dr. George Rogu from AdoptionDoctors.com, the go-to place for international and domestic adoption medical education services and consultations. Today I'm going to speak to you about the medical things to consider when adopting a child domestically from the United States. There are two types of adoptions that I've seen with domestics. There's the open and the semi-open adoptions. While this is nice and open adoption, people think that since we're in the United States, we're going to have an abundance of medical information on the child and on the mother. Sometimes with the open adoptions, the parent may be able to participate in the mother's prenatal care, visits to the doctor, may be able to be there during the actual delivery, and then take over the care of the baby later. With open and semi-open adoptions, usually these cases are done through an adoption agency or an attorney. Open adoptions are when a family has direct connections with the birth parents as the child grows up. Semi-open adoptions are exactly that, semi-open, where the adoptive parent can give some information and communications to the birth parents as the child gets older, and there can be some supervised visits, but there's little interaction between the birth parent and the child. Now, with adoptions domestically, you can get into the foster system when you will be adopting an older child. This is good because the child can live with you for a while before you actually adopt the child, and you can learn a little bit about the child, the ethnic background, the medical health of the child. Over time you'll learn about the parents' level of education and their occupation. You'll be able to monitor the weight and the health conditions of the child. Now with domestic adoptions, everybody thinks that there's going to be a multitude of medical information available. What I have found is, yes, there is a multitude of confusing medical education, because where with international adoptions you get a handful of pieces of paper with some medical stuff, domestic you get hundreds of pieces of paper. Many times it's just print all from a computer screen, and a lot of it is garbage. But within this you can tease out if the child has any medical problems, if there's any maternal medical problems. You can get a little bit on the mother's psychiatric history, which is often listed, the mother's medical history. You'll learn about the mother's alcohol consumption or smoking consumption during the pregnancy, and if she used any prescription or over-the-counter medications or illegal medications during the pregnancy. In the domestic adoptions, the most important piece of medical information that we often obtain are things about the mother's medical history. We'd like to know a little bit about the mother's age during the pregnancy. Obviously, the younger the mother, the healthier the child. Oftentimes I find on domestic reports the mother has a multitude of sexually transmitted illnesses such as gonorrhea, syphilis, chlamydia, HIV infection, hepatitis B. But the good news is that we can test for these things. And usually if the results are negative, I am happy with that as a screening tool, but we would check the baby later. The reports will give us a little bit of information about the prenatal care of the mother. What I found is the people that are doing a private adoption tend to go to prenatal care. The ones that are in the system that the child is being taken away tend to not go for prenatal care, and they just have the baby. Obtaining medical records does help, especially after the baby is born, because you'll be able to see if there's any problems that occurred during the pregnancy or shortly after the pregnancy or the delivery itself. After the child is born, the medical history is also important, because it'll tell us something about the child after the child is born. pertaining to height and weight to see if the child is growing, if there are any medical tests, if they're seeing any specialist, how they're reacting to the outside environment with people and relationships. Unfortunately, older children that are adopted domestically tend to be subjected to physical, sexual, and emotional abuse. What I found an awful lot on domestic adoption cases, especially those that are pregnant during the report, there's a lot of psychiatric illnesses, usually on the mother's behalf. Schizophrenia, anxiety, depression, bipolar disease, attention deficit disorder, and often you find opiate abuse. That's a medication that's used to suppress pain for various reasons, but it's highly addictive, and people with poor social economic statuses tend to abuse medication to depress the pain of life. I also find in a lot of the adoption cases high-risk behaviors and social issues upon the mother and the father. Oftentimes I'll find a multitude of drugs that are used during the pregnancy. These people that put babies up for adoption tend to have multiple sexual partners, multiple pregnancies, many abortions. Unfortunately, there is life on the street, involvement with the authorities. I've seen cases where the mother was incarcerated and did drugs, but the good news with that case was, at least if she was incarcerated, somebody was managing her and making sure she didn't do drugs during the pregnancy and made sure that she followed up with a doctor. But there is a potential for a lot of sexually transmitted diseases that can be transmitted to the baby. Medications that we find on the report are legal and illegal. Alcohol is one, marijuana, opiates, which would lead to neonatal abstinence syndrome. Many of these people have sleeping pills, diet pills, lithium, tranquilizers, anti-anxiety medications, Effexor, gabapentin, Ritalin, baclofen, and a whole slew of other medications. Now, I'd like to leave you with some final thoughts on the medical issues that we find on the domestic adoptions. The reality is that all adoptions, there's a risk, okay? Domestic, international, it's just simple. There's a risk. And you have to be prepared for that risk. You have to do your education and see how much can you as a family unit handle. You have to be aware that the records are not as reliable as you would think, because they tend to be too many records. I once had a case where 500 pieces of paper were documented and only about 15 pieces of paper were actually usable, where I was able to perform an adoption report and actually gather some information and make a story for the child. Many of the issues that we find on the maternal side are psychiatric issues, schizophrenia, bipolar disease. Just because the mother has schizophrenia does not necessarily mean that the child will develop schizophrenia. Schizophrenia is a problem that we often see, and it is triggered by an environmental condition. So life on the street is a stressor. So having a baby and living on the street and poor socioeconomic status and drugs and abuse, that certainly can trigger a schizophrenic effect. But if you take that child that's born to a schizophrenic parent and you put him into an intact, regulated family unit with, a good social outcome, maybe the schizophrenic effect may not happen as the child gets older. Oftentimes the poor socioeconomic conditions do exist, and there's conditions associated with this child. And many of the mothers that are putting their children up for adoptions have high-risk behaviors, drugs, alcohol, sexually transmitted diseases, and so forth. But the good news, as always, is that children do well once they're placed into an intact family unit. So even though the child starts off with a little bit of a deficit at the beginning, coming from a poor social situation with some conditions, if you take care of these conditions and you provide early intervention services and you provide a mother and a father and a family unit, these children can grow up and will grow up to lead a very, fruitful and good life. So, once again, my name is Dr. George Rogu from AdoptionDoctors.com. If you ever need any medical consultations for medical record reports, feel free to reach out to me at AdoptionDoctors.com.